Hi, I'm Nigel Hsu. I'm an orthopedic surgeon with Johns Hopkins at Howard County General Hospital. I specialize in foot and ankle surgery. Flat foot deformity is a condition where there's flattening of the arch in the foot. In children with congenital flat foot deformity, usually they are asymptomatic and they don't have any pain. In adults with adult acquired flat foot deformity, it's caused by a degeneration of the tendon that's responsible for holding up the arch and pointing the foot inward. When that collapses, you can see the foot pointing outward, and that can cause pain and deformity in the patient. In the office, we need to obtain a history and we carefully examine the patient. Usually there's progression of weakness, maybe collapse of the arch, pain over time. We may also get weight-bearing x-rays of the foot to evaluate the deformity and arthritis, and that can help us tailor the treatment plan for the patient. Depending on the severity of the pain and deformity, we generally recommend anti-inflammatory medicines. We may recommend a trial of boot brace immobilization, and then supporting the foot with orthotics and bracing. We would consider corrective surgery for flat foot deformity when patients fail conservative treatment or pain becomes too unbearable. The type of surgery we do for flat foot deformity depends on whether the deformity is flexible or stiff. For flexible deformities, we can do a flat foot reconstruction, which we realign the bone to restore the arch, and we often have to do a tendon transfer to replace the degenerated tendon that's stretched out. If the deformity is stiff and it's not passively correctable, then we usually have to do a triple arthrodesis or fusion surgery to realign the hindfoot to restore the arch. If it occurs in both feet, we generally recommend doing one side at a time because the patient will be non-weight bearing for a period of time. It's very difficult to be non-weight bearing on both sides. It's also a higher risk of complications when we do both sides at the same time. After the surgery, the patient can usually go home the same day. They'll be non-weight bearing for 6 weeks and start weight bear at 6 weeks in a boot and transition into regular shoes usually at 12 weeks. With proper surgical correction and rehabilitation, the patient can expect to have good pain relief and return to their active lifestyles.